So good. Hi guys, good morning. Happy Tuesday. Welcome to another AMA session with Dr. Ben. I'm Dr. Ben Behnam. I'm a board certified dermatologist, and I am one of the founders of Happy. Thank you so much for joining us. Um, so today's topic is: I'm starting to see results after 6 months. Should I keep using Happy? That's a great question. So the answer is, for Happy Head to continue to work, you basically have to continue to use it. It's still typically recommended twice a day, every day. Um, there are some patients that do say that going down to once a day maintains it, but that is not true for everyone. So I just kind of want to share that with everyone else. So yes, but in order to see the same effective results, basically you should continue to use Happy Head even beyond 6 months in order to see the great results we've been seeing. So, how does the doctor determine if you're a good candidate for Happy Head? Well, we look at your scalp. I mean, there are a couple of things. And we look at the past medical history. That's why there's a questionnaire online. And number two, we look at the hair, the scalp, how much density you have. I mean, there are some patients that we get photos where basically they're complete bald. So, we don't recommend Happy Head. And honestly, no other treatment is really going to work for those patients. However, if you have thinning hair, where when we look at you, basically I could see through the hair and onto the scalp, then you are like those are the most ideal candidates. Again, if you don't know if you're candidate or not, please feel free to send in your photos, and I'll be more than happy to take a look at it and let you know if you're candidate or not. That's what we're here to do. You can also go online and fill out our online questionnaire, and the doctor will evaluate you and also determine that as well. What conditions wouldn't be receptive to treatment? So obviously, if you're completely bald, then you are not, you know, it's not a good you're not a good candidate for Happy Head. If you also have scarring hair loss, then you wouldn't be a good candidate for Happy Head either. Um, so, and also alopecia areata doesn't really work that great for Happy Head. So really Happy Head, ideally works for patients that have just male pattern or female pattern hair loss. Um, I find that even a small amount of topical minoxidil causes edema in my legs and under my eyes. Is that something you've seen with others? Any suggestion on how to prevent this edema? So edema could happen. Typically, it's more common with like the oral minoxidil as opposed to topical minoxidil. However, it is still possible. It's actually very rare. I mean, we have thousands and thousands and thousands of patients on Happy Head, and the number of patients complaining of edema is probably less than 5 people. So, but it's pretty rare, but it could happen. There's really nothing you could do. I would just take the minoxidil out and just stick with the finasteride and the retinoic acid.
Okay, so if you're experiencing any form of like water retention, swelling from minoxidil, should you remove it entirely?
Yeah, I mean, so if you have any form of basically water retention, the two most common type of water retention is basically swelling underneath the eyes as well as ankle swelling. The ankle swelling very rarely happens with the topical. It's mainly with the oral, but I guess it could happen. One thing we could start reducing the concentration of the minoxidil, go from 8% to 5% or 6% and see how it does. And if that doesn't help, then we could basically take out the minoxidil. We don't want you to have that water retention. That's not a good look. Does the formula change as you grow hair back and where you apply after hair grows back? No, the formula actually remains the same. So if that formula is working for you, we don't usually change it. How often should I wash my hair per week and what should I use? Great question. So we typically actually recommend shampooing kind of every other day. That's our recommendation. And what you should use, we have the Happy Head shampoo. So I know everyone's saying, "Oh, you're just promoting it because your product," but honestly, here's the deal. First of all, it was made by dermatologists, and number two, it really has really, really good, basically, products in it and ingredients. And I'll go through some of the ingredients. So we know that biotin and collagen basically is great, and there are a lot of biotin and collagen shampoos out there. But we actually compared all the shampoos out there, and we tried to make the best ones. So not only we have biotin and collagen in our product, but it also has keratin, saw palmetto, and argan oil, and all of it really help to just basically, first of all, give you like a calmer scalp and a better, healthier scalp. And we have a patient this morning that Instagrammed us, and maybe we should probably snap a screenshot that and post it up. That he said that ever since he's been using the shampoo, he feels that the product is working better. So again, that's what he said. I'm just telling you what other people are saying. So it's a really nice shampoo. It has this very nice, soft, calm, citrusy smell to it. Again, we recommend basically every other day, and you should be getting sachets in your packages, and give it a try. See how you like it. Can I use topical dutasteride just once weekly along with my oral minoxidil? I can't add oral finasteride or dutasteride. I read topical once weekly is effective. Is that accurate? So let me see. You're carrying an oral minoxidil and you're doing the topical dutasteride once a week. I mean, doing the touch once a week is gonna help you. I mean, it's not gonna be as effective as you were doing it every day. It's gonna help you a little bit. Obviously, the more you use it, the better results you're gonna get. If you were to use the topical dutasteride 3 times a week, you will probably see better results. I just don't find using it once a week is gonna be very effective at all. That's my personal opinion. You're already carrying an oral minoxidil. I will probably do topical do 3 times a week, but probably titrate up. So if you're a very sensitive person, I would do it like just once a week for the first couple of weeks, and then twice a week for a couple of weeks, and then 3 times a week. Great question. Thank you. Do you recommend microneedling, or would once a week microneedling be too abrasive with the combination of topical finasteride, minoxidil, tretinoin? So we typically actually recommend, yes, microneedling, and we actually recommend microneedling nightly, every day. But I know a lot of people have read on the internet that you can microneedle using a 1.5 millimeter depth. We don't recommend that. What we do recommend is going to a much lower depth, like a 0.25, and doing it every day. So the recommendation will be apply the topical minoxidil on, and basically derma roll gently on top of it nightly, 0.25. Where do you apply after your hair grows back? In the same area so that you keep your hair. So let's say if I'm losing the front area and I apply happy head and then microneedle on top of it, and I do that for 6 months, and then my hair is it's coming back, I would keep applying the same area because you want to maintain that hair. Did you ever hear that DMSO can grow hair? Not sure how this works. So we actually looked that up a while ago. There's really no like really good clinical studies on it, so it's still kind of questionable. But Happy Head actually, if you look at the clinical studies, there are a lot of clinical studies on topical Happy Head. So if you go on Google and put in topical finasteride, you read all those studies, and that's how topical Happy Head was formed from all those clinical studies. So we're very clinically related, and we base everything on clinical studies. So if there's aren't like a lot of clinical studies on DMSO, for example, we're not really gonna incorporate it into Happy Head. How long do I leave it in because it's so drying? Are you talking about the product or the shampoo?
I think you're talking about the topical.
Yeah, the topical. Yeah. So you could probably wash it off after 1 hour. And if you could also use a leave-in conditioner, that's also going to help you basically with the drying. And if you're really dry, we do have a special serum that we could send you. So please send us an email at help@happyhead and say that you want this special serum, and we'll be more than happy to send it to you.
If they are experiencing like heavy dandruff and stuff like that, what type of shampoo? Or
Yeah, so if you're experiencing dandruff, basically the ketoconazole shampoo is great. There's a version that's non-prescription. It's called Nazarel. You can buy it on Amazon, but there's also a prescription grade one that will also help you with causing hair to grow out. Funny enough, the same dandruff, the same shampoo that's used for dandruff could also cause more flakiness and drying. So, but not in everyone, to see how it does. But yes, ketoconazole, we do have it. You just have to reach out to us personally. It's an anti-dandruff shampoo, basically, could also cause hair growth as well.
when would be abnormal to have like flaking and dryness? Because I know first 6 to 8 weeks is normal, but going forward, should you still have that?
Yeah, so typically some patients could experience some initial drying initially, but they do get better. But if the dryness and the irritation continues and it gets worse, please reach out to us, and we'll be more than happy to send you a special serum. And the serum basically will calm the scalp and kind of eliminate the dryness. Also, some of the dryness could be from the minoxidil, so we could also reduce the minoxidil concentration. And you could just wash the product out after 1 hour. We could also remove the retinoic acid as well, and that could also help. And if none of these help, then we do have the aqueous formula. That's the formula basically that has less alcohol in it, and that could help as well. Hello, I used the topical dutasteride and had horrible side effects. To ensure that won't happen with this product, please don't use our product. You are gonna have side effects again. You know, if you already had side effects to one topical dutasteride, most probably gonna have side effects to our topical dutasteride as well. So I highly recommend that you do not use our product. Thank you so much for reaching out to us. Specifically, it really depends what type of side effect it was. I mean, did you have sexual side effects? Was it the irritation? So if you kind of elaborate on that, we could probably help you a little bit more. If you like, you don't have to do it here. You could email us at help and happyhead, and they'll be more than happy to basically, forward your question to me, and we could talk a little more in detail privately. But if it's a sexual side effects, one thing you could do is that not to use the product every day. So kind of touch it up. It's kind of important. So you could just start with doing it once a week, and then twice a week, then 3 times a week. So you're going up slowly. If the topical dutasteride was mixed with minoxidil and retinoic acid, certainly we could take, and that causes a lot of irritation. Certainly we could take the minoxidil retinoic acid out to reduce the irritation. So it really depends upon those horrible side effects. We'd love to hear more.
What would make a good candidate for dutasteride? Who would?
Who would make a good candidate for the test ride? Um, a good candidate is someone who had tried the topical finasteride and has failed topical finasteride. So then they would be a good candidate for the test ride. There are some doctors that are putting patients directly on top of the finasteride with that and skipping finasteride, and that's fine as well. Everyone is different. The way I look at it is that there aren't really that many other drugs that will really help you with your hair. You either have finasteride or dutasteride or minoxidil. So I would probably try the finasteride first and see if that works. And if it doesn't, then I will go to the last resort, which is the dutasteride.
So you would suggest slowly uptaking finasteride, then dutasteride.
Yes, is that I would do the topical finasteride first. Yes. Yes. So let's see. So tried oral finasteride gynecomastia, which is basically breast enlargement. Currently, I'm on 1 milligram per week. Would topical help in this case? Yes. Topical could help basically in this case. Again, I will touch it up slowly. Remember that topical finasteride could still give you gynecomastia, but that is very, very, very rare. We've probably yet to hear one from topical finasteride. Um, from topical finasteride causing the gynecomastia, which is the breast enlargement. But no, that breast enlargement is not reversible. You have to please understand this. It is not reversible. So if you really feel you're getting breast enlargement from finasteride, I would just stop completely.
Is this like a hormonal change or is it like a swelling?
It's more like tissue enlargement. It's a true tissue enlargement. So
Is that dangerous?
it's not dangerous. It's just the fact that a lot of people don't like to have male breasts.
Makes sense. Okay.
Guys, Evelyn here is asking all the questions. So yes, it makes sense. Guys don't like to have male breasts. That's what it is. Yes. Okay. So, sorry, I didn't add. I was severely depressed on oral finasteride. So using topical dutasteride once a week initially. So yeah. So look, if you take oral finasteride and you're severely depressed, uh, you still have to be careful using the topical ones because that could still cause depression. So the idea is number one, you have to wait until you have to stop the oral medication. Two, wait until your depression completely goes away and you're back to normal. Number three, if you do want to start, which I would be very cautious about, I would start with a very low dose of the topical and only do like 1 pump once a week. Then you slowly go to 2 pumps 1 pump twice a week, then 1 pump 3 times a week. So you slowly want to titrate upwards. So you never really want to get to the full like 2 pumps twice a day. But if you titrate upwards, you're gonna do well as long as you don't get depressed. Is a niacin flush helpful for hair loss? No, it is not at all. Well, I mean, I don't think it's gonna hurt you, and I don't think it's gonna help you either. I understand why the idea is that means if you're flushing, that means you have more visualization of your face and scalp. There's more blood flow is getting there. I don't think there's really been any clinical studies looking at the niacin flush and also hair growth. I mean, that's a good, interesting idea. But I don't think anyone has really looked into that, but I don't think it's helpful or hurtful. Not that I know of.
There's a question on the top. Hey, Dr. Ben, just tuning in now. See that?
Which one? Oh yes. I'm getting it right now. That was a long one, so I had to skip it. Skip it for a second until I answer the other ones. Hey, Dr. Ben, I'm just tuning in now. A question I have regarding derma rolling. Would you recommend using derma stamp instead? And with a derma rolling, could we just do it horizontally and vertically instead of doing it diagonally too? That's a great question. Look, guys, there's no real rules with derma rolling, but there are a couple kind of soft rules. One, don't press too hard. Okay. Number two, don't make yourself bleed. Number three, I rather use the lower depth as opposed to the deeper depth because it honestly hurts. Now, do you have to do horizontally, vertically, diagonally? Look, just do it for a minute, left, right, up, down, whatever you want. I don't think there's really any rules. Classically, what they would recommend, it was like 8 times going back and forth up, eight times going basically left and right, and then 8 times going diagonally each side. But again, there are really no rules. I do like derma stab a little better than derma rolling. I think it's sometimes easier to do, and especially for people that have longer hair. So if you want to get derma stab, that's good. If you want to get a derma pen, which is an automatic derma roller, you can find them on Amazon. Those are great as well. Thank you so much for that question. Also, do you recommend using a henna hair dye to cover some gray hairs or anything else? And is it alright to use any hair color with hydrogen peroxide too? Or could that be too harsh on the hair or interfere with our hair growth treatment? Great question. So, you could use henna hair dye coloring. I'm fine with that. There's no problem. I do not like hydrogen peroxide. I will repeat that one more time. I don't like peroxide. Reason is because peroxide is used basically to bleach out the hair, and it truly really does damage the hair. So when patients basically want to dye their hair, I always say you shouldn't dye too much. You shouldn't use very strong stuff to dye your hair. Using the sulfates-free ones are probably the best ones, and try to avoid going lighter. Because in order to go lighter, like that means bleaching your hair or going blonde, which means you have to use a peroxide and you have to do it multiple times, and the peroxide basically removes the pigment, and that will damage your hair. So going darker is okay, but lighter is not.
Okay, so if you have really damaged hair from like dyeing and bleaching,
Yes.
would it reduce the effectiveness of the medication?
Yes. Well, here's the thing. So it's not the fact that it's going to reduce the effectiveness. No, it will not reduce. You're just going to damage your hair. Bleaching a lot, keratin treatments, all those will damage your hair. And also, if you use very like hot liquids on your scalp, hot combs, all that will also damage your hair as well. So the less you do to your hair and the less you touch it, the better off you're gonna be. Do you ever use topical dutasteride and topical finasteride together? Yes, we in fact have a special formula like that. It's called the kitchen sink. Our CEO came up with that name. Would it make sense to do that? Look, for some patients it does, and for some patients it doesn't. I think the kitchen sink is based on a clinical study, actually. And now you're gonna say it's redundant because dutasteride inhibits both enzymes, 5-alpha reductase 1 and 2, and finasteride you're already inhibiting one of the enzymes. So what's the point? You're right, but for some reason that we don't clearly understand, when patients use the finasteride and dutasteride together topically, it works better. We don't get it, but it just does. Now, practically speaking, I think what most people do, this is how what most people do it. Usually, a lot of patients start with either topical finasteride or oral finasteride. They do it for 6 months, and sometimes it works and they plateau, or sometimes it doesn't work, or they want to see better results. So then what they do, basically, then they add the other version. So if you're doing a topical finasteride, then you add an oral finasteride to it. And if you are on oral finasteride, you add a topical finasteride to it. And in fact, next week, hopefully, we're going to share a photo of one of my patients who was on oral finasteride for many years, and then he added topical, and he really got a huge boost to the hair. And we see that quite commonly because we truly believe that when you sandwich the hair from top and bottom, that means you're taking the pill from the inside and you basically apply the topical on top. You're kind of sandwiching that hair. For some reason, patients do way, way, way better. Not in every case, but a lot of the cases. So doing the topical and oral together will give you better synergistic results than doing one alone sometimes. Also, there are some patients that might do topical finasteride for 5 days a week and also do topical dutasteride the 2 days out of the week. that works for them, and they see better results than using the same finasteride every topical finasteride every day. And I guess the reason is because probably your scalp doesn't get used to it, and that's a good that's a good treatment plan. There are also some patients that on oral finasteride every day and again, and they're kind of alternating between topical dutasteride and topical finasteride topically. And there are many different ways of doing this. There's really no simple way of doing it. But the key is to start with one product and see how you do and track your progress. And then we could always add other stuff to it. How soon after FU can I use Happy at 6 weeks? We have a lot of our patients that got on Happy after hair transplant. Can infrared saunas be harmful or helpful for the hair? Sometimes put a conditioner on hair and a cap and get in, but not sure if the infrared heat can be harmful. I don't think it is. There's really no clinical study showing that infrared heat is harmful to the hair. Otherwise, everyone that's basically in that sauna will be bald, and that's not the case. So I don't think it's helpful or hurtful. Do PRP injections help regrow hair? Absolutely. We do a lot of PRP injection in our office in LA. And yes, it does. PRP does help. Should we wash our hair every day? Smiley face. I typically, so it depends on the individual.
With a gentle shampoo.
With a gentle shampoo, I think is yes. As long as using a gentle shampoo, that would be okay. Traditionally, in derm offices, we recommend basically every other day. But look, some people they sweat and they exercise, and you can't really leave all that sweat, in your hair. So basically, for example, I wash my hair every day, but I don't necessarily shampoo every day. But I definitely do wash it. Can antihistamines help male pattern or female pattern hair loss, especially as if you have the MTHFR mutation? There really hasn't been really much clinical studies about antihistamines and hair loss. I'll look into that, but I don't think that's the case, though. What is the cost of the PRP injection, and how frequently would you like to do it? So the PRP injection, so typically everyone does it differently. In our office, we use like a really huge volume of PRP. So a lot of doctors use only 10 ml. We use like 60 ml. So I only do it twice initially, and then every 9 months I repeat it. The cost in our office is about $1,500 per session. We're a little bit more expensive, but honestly, you're really paying what you get for. I have patients who've done 4 PRP sessions somewhere else, and they only paid $1,500, and they come to me and they've had no result. I'm like, well, you always get what you pay for, because what a lot of doctors are doing, they only draw 5 mLs of blood, and they're doing it like a million times. Whereas we do 60 ml of blood, we spend it for almost 45 minutes. It's a double spent PRP, and it literally just takes me 20 minutes to inject you, and we numb you, and we have laughing gas too. So the technique is completely different, and we're very proud of our technique. So it sounds like that henna hair dyes or anything more natural without the peroxide is what we should try to look for. Yes, that is correct. If you want to basically dye your hair, try to find something that's peroxide free and sulfate free. That's correct.
All right, so I'm gonna post the little 3 fun facts, and if you want to just give an overview of your career.
Oh, sure. Yes, here we go. Career. Yeah. Here we go. What are the fun facts? Yes, let's talk about this.
So that's the one.
Oh, here. Oh, yeah. I just read them. Okay. So let me see. So, fun fact. So, everyone just put this on. Dr. Ben's recognized by Newsweek as one of the 10 top dermatologists in the US. Yes, Newsweek that published that. That is correct. We're very proud of it. So, it's basically in the office. It's me and Dr. Sean. We both practice together, and we are hair specialists. And our goal is to really always try to push the envelope of hair and medicine. So, and we're working really hard with the team at Happy It to really come up with just better things for hair. And we really have a lot of cool things coming down in the pipeline. But we are just waiting for our website to be updated. believe it or not, there's a lot of complicated stuff that goes on in the back end as soon as when you click that submit button. So we just need to make sure that the website doesn't break down when we add our other products. Hennas could contain metals. As a hair dresser, I suggest 5 volume of low peroxide ammonia-free color. Oh, Joyco demi-permanent. Keep it off the scalp as best as you can. I love it. Thank you so much. I really appreciate it. We've actually learned a lot from our hairdresser patients. I tell you, the reason that why we recommend using a leave-in conditioner is one of our patients recommended that he was a hairdresser in New York. So I really appreciate that. Thank you so much. Maybe we could post that and keep that somewhere so we could tell that to our patients. Oh, I already answered that. Here we go. Okay. Is it normal to notice some more hair shedding some days compared to others? As that's I've been noticing sometimes when I wash my hair more and apply the treatment, I get more hair shedding. Yes, that is correct. Um, Look, we have to realize hair is cyclical. So you're gonna go through some months where your hair is great, and you're gonna go through some other months that your hair you're shedding a lot and it's crappy. That's normal. Your hair a lot depends upon your cortisol level, your stress level, and your hormonal level. So, and that's true with the days of the month and the days of the week. So it really depends on what you eat, how stressed you are. So yes, that is correct. Your hair fall and the amount of hair that you shed basically changes with time. Oh, thank you so much, Barbara. Yes, it says the guy who answered the call is so lovely. Think smiley face if I could do it, but I can't do smiley face. Yes, that could be Kyle or Alexander from customer support. Thank you. Oh, it's Kyle. Kyle, somebody likes her a lot. That's great. Kyle is currently sitting in the other room. Is he here today? Oh, sorry, Kyle is not here today. But I would definitely send him the message. So guys, a couple other things. So remember, derma roll is really important and it's very effective. We love derma rolling, and that's very important. Number two, if you have any issues with your topical formula, please let us know. I was on a call with a patient of ours who actually was using an oral finasteride and a topical dutasteride from another company, and had some side effects. And he was then using a topical dutasteride that was 0.7%, and he got significantly sexual side effects. So you have to realize the number always doesn't mean the higher the number, the better it is. The key is to be conservative, and it's not a race. So the slower sometimes you do things, the better it is. So we always say, if you want to start something new, kind of titrate up slowly. You're just going to end up using the products for a longer period of time, and you're going to have much better results. Number three, sometimes combining the products with other things might work better. So, for example, like using the shampoo along with the topical happy head is probably going to work better. We're coming up with our own supplement products. That's also very important. But also sometimes patients use like topical happy head for like 8 months, seeing great results, and all of a sudden the results plateaus. And we see that all the time, even with the oral finasteride. So then at that time it's important basically to add other modalities. So if you're on topical finasteride, you could add an oral finasteride. If you're already on topical and oral finasteride, sometimes you might add oral minoxidil. So everyone's different, and this is why it's so important. Sometimes we will get on a call together and kind of try to come up with a treatment plan, and everyone's unique. Yesterday, I had a patient who flew from New York to see me, and he was already on topical dutasteride and taking oral finasteride. So oral finasteride with topical dutasteride, and he was not seeing the results that he wanted. So we ended up putting him on oral minoxidil. So again, everyone's different. The whole point of Happy is not one size fit all. We try to customize the product for you, but also there's also customized treatment plan. So we might add other stuff to make it work better for you. Oh, thank you so much, Chris. Really appreciate it. He said, thank you, everyone, for the info. Thank you for the great session. Thank you, Cher. She sent an email regarding her hairstylist status and no reply. We will look up that email. If you don't mind just sending us your email address, and we'll look that up. That would be great because we don't know your full name. So thank you so much. Okay, everyone. Well, thank you so much for coming on call with us for another happy and successful AMA. We really enjoyed these AMA sessions. So please keep asking all these questions. I think we all learn from them, including us. We all learn a lot. So please give us your feedback. If you have any questions, let us know at Health and Happy Head. And please, if you could just review us either on Facebook or Trustpilot, we really do appreciate it. Have a beautiful day. And if there's any questions, just feel free to reach out to us. Bye, everyone. But and again, thank you so much, as always, to Evelyn, who helps us put everything together, and Eric, our VP of operations. Thank you.